Hi, I'm Dr. Avedis Ekmejian, a cardiologist at Royal North Shore Hospital. If you're watching this because you're experiencing chest pain, it's important to know this. Chest pain should never be ignored. Some causes are mild, but others can be life-threatening. So let's briefly cover what chest pain can mean and when to seek help. When is chest pain a medical emergency? Call 000 immediately if you have severe, crushing or heavy chest pain spreading to your jaw, neck, back, shoulders or arms, shortness of breath, sweating, nausea or vomiting, feeling faint or unwell, and pain lasting more than a few minutes or returning after rest, or chest discomfort plus a sense that something is very wrong. These may be signs of a heart attack. Don't wait. Calling an ambulance is the safest option. What chest pain can feel like and why it's not always the same. Heart-related chest pain, or angina, doesn't always feel the same. It might present as tightness, squeezing, pressure, heaviness or burning, indigestion-like discomfort, or shortness of breath, dizziness or fatigue. Women may experience more subtle symptoms such as fatigue, nausea, breathlessness, back discomfort, or even just the feeling that their bra strap is too tight. Chest pain that's not an emergency but still needs attention. Chest pain that comes and goes, lasts only seconds, or settles with rest might not be a heart attack, but it still could indicate angina or another cardiac condition. Book the next available appointment with your GP or cardiologist if you experience chest pain or discomfort with exercise that settles with rest, repeated episodes of unexplained chest pain, chest tightness, breathlessness or unusual fatigue, or symptoms that don't feel normal for you. You know your body best. If something doesn't feel right, get it checked. Chest pain when arteries are clear, otherwise known as INOCA. Some people continue to experience chest pain even where their angiogram shows no major blockages. This is called INOCA, Ischaemia with no obstructive coronary arteries. It's a condition that is more common than many realize, particularly in women. Two main causes are coronary microvascular disease or coronary vasospasm. Coronary microvascular disease, otherwise known as CMD. This is where the heart's tiny blood vessels don't widen properly, reducing blood supply that may be exposed during physical activity. This can cause chest pain, breathlessness and fatigue. CMD can significantly affect quality of life, but with the right testing and treatment, symptoms can be managed and improved. Coronary vasospasm. This occurs when a coronary artery suddenly tightens or spasms, temporarily restricting blood flow, often at rest or overnight, even when arteries appear normal on standard testing. This can be diagnosed with more specific advanced testing called provocative testing. When should you seek help? Call 000 for severe or ongoing chest pain. See your doctor for recurring, unexplained or worrying symptoms, especially if you've been told your arteries are clear but symptoms persist.
If you come into hospital with chest pain and we're concerned about a possible heart attack or unstable angina, you may be sent to the cardiac catheterization laboratory, which is more often called the cardiac cath lab. This is where you'll meet someone like me. I'm Nadeem Mughal, and I'm the chief radiographer of the cath lab at Royal North Shore Hospital. What exactly is a cath lab? The cath lab is a specialized room where we use X-ray imaging to look at the heart's arteries. The most common test we perform is a coronary angiogram, which helps us visualize your coronary arteries and determine whether or not there are any problems with blood flow. What happens during a coronary angiogram? Here's what you can expect. Number 1, we access an artery through your wrist or your groin and insert a thin tube called a catheter. Using live X-ray imaging, we gently guide it to your heart. We inject a small amount of contrast dye to help visualize the coronary arteries. We then take detailed pictures that show whether your arteries are open or narrowed and how well the blood is flowing. If we find a significant blockage, we may treat it with a balloon and a stent immediately to restore blood flow. Angiograms may be done in an emergency, or when symptoms worsen, or as a planned investigation. If you'd like more detail, Heart Research Australia has a helpful angiogram video available at heartresearch.com.au. When the arteries look clear, if no major blockages are found and INOCA is suspected, we may run additional tests to assess the smaller vessels in the heart, including coronary flow reserve, CFR, to assess the heart's ability to increase blood flow during stress like exercise. Index of microvascular resistance, IMR, to assess coronary microvascular function. Acetylcholine testing to check for coronary vasospasm. These tests are safe and provide an information that a standard angiogram cannot. It is important to remember that if you are told your arteries are clear, this doesn't mean your pain isn't real. It may simply mean further investigation is needed.